Hello and welcome to Inspired into Action, where I interview inspiring women who are taking action in their business.
Hello and welcome to Inspired into Action. I'm your host, Tara Omatosho, and today we are hearing from nurse practitioner Rachel Nelson. How are you doing today, Rachel?
I'm wonderful, Tara. How are you?
I'm doing awesome. Rachel, thank you for taking time out in your schedule to talk with the listeners about what it is that you do. Can you tell them more about yourself and explain to them what your business is?
Yes, so I am a family practitioner and I started a business. It's called Access Wellness Healthcare. And what I do is I provide primary care services in the home. So what that means is for patients who can't get out of their home, elderly, even if they're not elderly and they're having difficult times, I can go out to see them. I provide all primary care services, including treating acute and chronic illnesses. To be, for an example, that's like a urinary tract infection, a common cold, sinus infection, allergies, asthma, COPD, diabetes, hypertension, hyperlipidemia. So I treat everything. You know, I'm just like a regular physician, except I'm a nurse practitioner.
Wow, that's awesome. Have you always, how long have you been a nurse practitioner? And is this something, well, first of all, let's go back. How can people find out where to get in touch with you? If they want to, access your services or they just want to talk to you about something, how can they get in touch with you?
They can access my website. It is accesswellnesshealthcare.com.
Okay.
They can go on Facebook and look me up at Access Wellness Healthcare on Facebook, and they can send me an instant message, or they can just click on my website and they can actually schedule an appointment directly from my website if they would like to do that.
All right, cool. All right, good. Okay, so back to the question. How long have you been a nurse practitioner, and what made you want to become a nurse practitioner?
I've been a nurse practitioner for 17 years.
Wow.
I wanted to become a nurse practitioner because I wanted to be able to provide primary care and to treat people like I want to be treated, like my own family member. And I have a heart for others, and I have a passion to heal. And I think it's something that, God has put in my heart. So, that's how I went after becoming a nurse practitioner. I mean, you see so many doctors that are so busy, and you have to sit and wait for like an hour, 2 hours, and I wanted to be able to provide something different, a different type of personalized care.
And so how is this bringing the care to the home? How is that going? When did that start, and how's that going?
Well, I started it about a year ago. I launched my website July of 2017. And since then, I started with maybe 15, 20 patients, and now I have 145 patients.
Wow, 145 patients.
I do, yes.
Wow. And so, but before you stepped out on your own, you were employed by a doctor. So how is this different from working for yourself versus working for a doctor or an office?
Well, it's very different. I've always worked for corporations.
Okay.
So I worked for Washington Hospital Center as a hospitalist, nurse practitioner. I worked for University of Maryland Community Medical Group as a nurse practitioner. And I've worked for the government as a practitioner. And in doing so, it's more restrictive because you have 15 minutes to see patients. Maximum, if you have to do a pap smear or physical, they may give you 30 minutes, but it's not guaranteed. So you always feel like you're rushing. It's always a rush. Hurry up, get them in, hurry up, get them out.
Yeah.
And that caused a lot of stress because, you can't really assess somebody's problem depending on what the problem is in that short period of time, and then get everything charting done, everything. It's not realistic.
Right.
So with me providing care in the home, I can spend the time to get to know the family. I can see them in their own personal environment, and I'm able to make a difference because, I'm building relationships,
Mhm.
and relationships, they last.
Yes.
And it's not just me hurrying up to get them in, hurrying up to get them out. It's me actually listening
Right.
to what problems are, and then I'm actually able to prioritize and problem solve.
Right.
So the actual difference is I'm actually now walking in my passion, and I'm actually now able to provide the care that sometimes I felt like I couldn't provide as well when I work for somebody else.
Wow.
So
Yeah.
it's amazing.
Yeah. No, excuse me. I think that's awesome because um, my previous profession I was a social worker, and oftentimes you really don't get a good grasp of who someone is until you're in their own environment. You get to see not only the reason why they're having the problem that they're experiencing in their body, but you see why. You see the manifestation. You probably see certain clues and keys in people's houses. Not that you're looking for it, but it just happens. So then you're able to make a more informed decision, or everything sort of pieces together like a puzzle, because you're like, oh, this is maybe why you're experiencing this asthma or something, because maybe the vents need to be clean, or maybe air duct person needs to come out, or certain things may trigger to say, oh, maybe this is why you're experiencing this problem. Let's try to take care of that and see how it changes things. Where if you go to a doctor's office, you're only limited to what the person is telling you. And at their house, because they're comfortable, you get to see more, and you can better pinpoint the reason why they're experiencing the problems that they're experiencing. Do you find that to be so?
I find that so.
Yeah.
I relate my care and how I treat them based on the environment. I can see what kind of support system they have.
Right.
I can see what kind of resources they have, depending on who I need to contact in the community. If I do need to contact a social worker, because I need social work services in the community.
Yeah.
And I also, if they need a hospital bed, I can get the hospital bed ordered. If they need a bedside commode, I can get a bedside commode ordered. I mean, I can just see if they need home physical therapy, home occupational therapy, they need home RN services, a nurse to come in, patient, I can order that for them. And so, that is just, it's so rewarding, to know, able to impart change people's health, like for example, yesterday, I was able to see one of my patients last night. She had a urinary tract infection, and she was going on vacation. She has multiple sclerosis.
Okay.
And I went in and made a nice visit with her last evening, and her and her husband were just so happy to see me, show me pictures of their grandkids and, their family and stuff like that. So they are looking at me now as a part of their family.
Right, right.
I spend the time, I'm available. They can text me, it's like I'm walking beside them with her care. And I wanted to make sure that before she left to go to vacation, that I saw her, I made sure she had everything that she needed, and that, she was getting better from the urinary tract infection. So it's like taking that extra step.
Right.
And I'm able to do that now. And when I go to work, it doesn't feel like work. It actually feels rewarding, and it's like, wow, I didn't understand what people would say when they say, man, I really love my job, because me working for other people for so long has never really worked for me, because they confine you, they constrict you, they put all of these unrealistic expectations on you. And then when you have family, they don't care about your family. The bottom line is, what can you do for me? And that's it. And so because I'm a mom and I have 3 children and who are my priority and my responsibility, I need the flexibility to be shift my schedule sometimes. If my children have something going on, if I got to take them this place, that place, that alleviates that pressure because of myself.
Right.
you know, and I don't have anybody over my head saying,
Did you do that? Did you do that? Or where are you? You're late. Why aren't you here at this time? You really can say, hey, I have a 10 o'clock appointment with my kids. It's going to last about this long. And then you can schedule something at 12, depending on how long it takes you to get there, and still be able to meet people's needs. That's awesome.
and you know what I do? Usually when I go out to the home, give
Mhm.
them a range. Because I can, if they have an appointment at 10, I'll say I can be there between 10 and 12. And the
Right.
reason that is because what if something comes up? It
Right.
gives me room, travel time to get from one location to the next. So it makes it a lot, it just makes my life a lot easier.
Yeah, that's awesome. That's awesome. So in this time that you have been working for yourself, what have been some of the things that you have found out from working for yourself that you would definitely recommend? If there's a nurse practitioner out there in the, that listens to this interview and they are ready to go out in their own private practice, what are some things that you have learned that you would recommend them doing?
What I've learned is that you can do it. You have to put aside your fear and you just have to take a leap of faith.
Mm.
And what I would tell them is that they're knowledgeable, they're qualified, and they don't have to depend on somebody else to validate their skills or anything else. Because believe you me, the doctor that they're working for is making millions of dollars off of them.
Right.
Or they have these beautiful luxurious homes and they're driving around in Teslas and have swimming pools and tennis courts in their backyard, and you're just struggling trying to make it from day to day and check to check
Right.
because they're not paying you what you're worth. You're worth way more than what they could ever pay you. And so when you're worth, that's when you can step out and say, I can do this, because they're making so much money off of you. But then, of course you don't have to deal with all of the administrative stuff because that's all taken care of for you. So that I can say has been my biggest challenge.
Okay.
Administrative, the billing, finding people you can trust. I mean, people that want to partner with you.
Right.
That is probably the most challenging.
Mm-hmm.
I've been exceptionally blessed to have a mentor. I do have to say, even though she's not a nurse practitioner, but she's in healthcare.
Right.
And she has literally walked beside me and inspired me and really helped me to stay focused, even the days that I felt like, oh my gosh, can I do this? Am I able to do this? And she's like, yes, you can, just, you got to keep plugging at it. And, and it's just been an amazing journey.
Mm-hmm.
Because I've seen where I was when I started last year in July,
Mm-hmm.
where I am now, and I've seen the growth and I've seen how the business is expanding.
Yeah.
And it is amazing.
Yeah.
It is really, really, really amazing. So I think that it's teaching me how to become better organized, and it's teaching me how to set boundaries, because although I want to provide excellent care to my patients, I still do have a life. And so I can't be available 24 hours. There has to be a time where I say, I'm not available. You're going to have to wait, at least 24 to 48 hours. And that's reasonable, you know.
Yeah, I find that to be challenging too, as far as just having your own business and you, if you don't answer your phone, you may not get any business. So it's like, do I always answer my phone or do I don't? But then at the end of the day, you have to say, what is my priority? If that person can't wait or that people can't wait, then is that maybe someone who I want to be partnership with in business? Is that maybe someone who I want to work with at this time? And if people don't understand maybe where you're coming from, as a business owner, you have that choice. And I think that's the beauty of, entrepreneurship, is that you have choices. You can make your own decisions as far as like who you want to work with, who you don't want to work with. And it's okay,
I agree 100%. And I think that learning how to set boundaries, because like you said, if you don't answer your phone, is that a client that you're missing, a new patient? And
Right.
the thing, what I'm realizing is what is for me is going to be for me. So whether I answer the phone or not, I still need to realize that I cannot be everything for everybody all the time.
Yeah.
That there's a certain time and place for everything. But I guess when you first start out, you get so excited
Yeah,
and
you do.
please everybody. You just want to be available. And then once you get that clientele, you want to be able to keep the clientele. That's the thing. You
Right.
get the client, you want to be able to keep them. And keeping them, you have to be able to provide good customer service. So I think, customer service is key, being able to accommodate, but then also set boundaries.
Right, right. That's awesome. That's awesome. You share with us about you always wanting to be a nurse practitioner, but who inspired you? Oftentimes in life, there are people that we look up to or we look for. Was someone a nurse practitioner in your life? Is that why you became one? Or, what inspired you to become a nurse practitioner?
Well, no, actually, case I didn't, that inspired me to become a nurse practitioner in my family. When I was a regular nurse, what I realized is that it's a lot of hard, it's like manual labor. And people don't realize that to be a regular RN, to work in a hospital, nurses are humping. They are working hard, diligently.
Yeah.
And I was like, man, I don't want to be running up and down these hospital halls for the rest of my life. I got to do something different,
Right.
So I realized, becoming a nurse practitioner would allow me to have better hours, because in the hospital, you have to do night shift.
Yeah.
You do an evening shift sometimes. And then the people who've been there 20 years, they get the day shift.
Right.
So, and you have to work 12-hour days. So at least I have to find something that's going to work better for me, because I didn't want to work like that. I mean, so I wanted more of an office setting. And then when I looked at the master's program, I said, okay, I like to teach too. And then I said, but then I also love hands-on. I'm very hands-on, clinicals I enjoy that part of what I do. So I said, well, the only way to do it is to be a nurse practitioner. And then I had to decide, do I want to be a women's health nurse practitioner? Do I want to be an adult nurse practitioner? Or do I want to do family? And I said, well, if I do family, I can do everything.
Right, right.
Tells children, adults, geriatrics, it does everything, So I said it would open up my opportunities to do more if I did family.
Okay.
That's what inspired me. I didn't want to work 12-hour shifts for the rest of my life. And I didn't want to, I just didn't want to run up and down the hospital halls. So
yeah. Well, that's good to know, because there may be some nurses out here that are listening and they're like, oh, man, I want to do that too. So real quickly, what do you say to them if there's a nurse out there that wants to be a nurse practitioner? What advice would you give them? And then I'll sum it all up with just maybe some last words about some advice that you would give to someone who is maybe interested in starting your own business. Because when you become a nurse practitioner, do you have to work for someone right away before you start private practice? I don't know how that works. So can you mingle that into one answer?
Absolutely. I can do that. Okay. So the first part of it is, if you are an RN and you want to become a nurse practitioner, the first thing I would recommend is to go back to school, because you have to have a master's degree to be a nurse practitioner. And then in order to be a nurse practitioner, you have to have a bachelor's, because, RN has so many different levels. You can be an RN with a diploma. You could be an RN with an associate's degree. So in order to be an RN nurse practitioner, you have to have a master's degree.
Okay.
I mean, you have to have a bachelor's degree.
Mm-hmm.
A bachelor's in order to start the master's program.
Gotcha.
Right. And so the first thing I would do is recommend you go back to school. And then as far as starting your own practice, I do not recommend any nurse practitioner start their own practice until they at least have 5 or 10 years experience of solid experience as a nurse practitioner.
Gotcha.
because it's not easy.
Hmm.
You know, you have to have a solid knowledge base because you don't know what you're going to get. And you have to be able to utilize your resources. You have to have those resources because we're talking about people's lives.
Right.
And so I don't recommend anybody start right away saying, oh, I'm just going to start my own, my own business. Because if you don't have the knowledge and the background, I'm talking about clinical background,
Right.
then that's not safe for patients.
No, you're right. You're right.
You have to work for somebody and you have to get that experience. And I would recommend that you get a mentor. The thing is that the way that you learn is you learn by other people. When I was a nurse practitioner student, I had this wonderful preceptor that I'll never forget. And she and I are still friends to this day. And this was well over 20 years ago because, practitioner for 17 years and I had to go to the program. The program was 2 years.
Okay.
So her name is Bernice Francis, and she actually lives in Portsmouth, Virginia. And she was the best preceptor ever. Like she was so compassionate. She was thorough. She was smart. I was like, oh my gosh, am I ever going to be as smart as her? I kept thinking, am I ever going to know as much as she knows? I was just like sucking in all the information. And the fact, that she's African American, she just inspired me, and I wanted to be like her. I'm like, if she can do this, then I know I can do this. I mean, she was respected by her peers. She's a resource, and she's just really smart, and I was like, oh my gosh, so I looked at her as like what I wanted to be. And so, even when I first graduated, I'd call her with questions. Bernice, what do you think about this? What should I do about that? And she would be willing to help me and, guide me through. And even when I had years of experience, I would send like cases to her and be like, what do you think about this?
Yeah.
And she would make herself available, and so I think having a mentor, knowing that you don't know it all. I think the key is realizing that you don't know everything,
Right.
and always be able to figure it out, but you always have to know where to go to get the information.
Right. Where to go to get the information and relay it back. That's the most important thing. I don't think anybody, or even in what we do, I don't know it all either, but I know where to get the answers. And that's the important piece of it. Yeah.
The only way you do that is
Yes.
And that's, you have to have some experience in order to be able to do that. So that would be my recommendation to anybody listening as an RN who wants to be a nurse practitioner. Get your experience, get a mentor, someone that you can learn from, somebody that, you can collaborate with. Because in nursing, things are changing constantly. And medicine is changing constantly. So you have to be able to be up with the times, and be able to change with the times. And so, that's what I would say.
Okay. All right, cool. Thank you, Rachel. So again, where can people find you if they want to get in touch with you in regards, they want to maybe see you or solicit your services? How can they get in contact with you?
They can get in contact with me by my website. It's accesswellnesshealthcare.com. They can get in contact with me on Facebook. I have a Facebook page. You can just type in search Access Wellness Healthcare. They can call me. My office number is 410-424-7993. And that's how you can get in contact with me.
Okay. All right, great. Thank you again for taking the time out to speak with our listeners about becoming a nurse practitioner and all that position has awarded you. I thank you for sharing all your information, and have a great day, okay?
Thank you.
All right.
Bye.
Bye-bye.